covidtests.gov. What's that about? Why are we doing that? We're doing that because the administration has put in a lot of work and resources that we had from ARP to acquire tests and make sure we had adequate number of tests. Given the spread of infections that's happening across the country, we know use of rapid tests is a very effective way of keeping infections down. You can test yourself before you go to a large gathering, before you go visit someone vulnerable. It is an important way of reducing spread of the virus. Very good evidence that use of rapid tests can reduce the amount of infections that's happening out there. So this is one of the tools we have, one of the capabilities we have. We opened that up on Monday to a third round. We've seen really impressive demand.
Right now, as shown on this map, over 32% of Americans live in an area with a medium or high COVID-19 community level, counties shown in yellow or orange. Since the prior week, an additional 8% of the U.S. population is living in a county with a medium or high COVID-19 community level. For areas currently with high COVID-19 community levels, those in orange, we urge local leaders to encourage the use of prevention strategies like masking in public indoor settings and increasing access to testing and to treatment. What we've seen with prior increases in infections in different waves of infection have demonstrated that this travels across the country and has the potential to travel across the country. So I think the important thing to recognize is that we actually have the tools to prevent it. And so we would ask you to wisely use these tools.
There's a range of models out there of what we might see in the fall and winter. We have got a plan for a range of scenarios, including we have to plan. It would be irresponsible for us not to. We have to plan for a scenario where we don't get any more resources from Congress. I think it'd be terrible. I think we would see a lot of unnecessary loss of life if that were to happen.